Today's update on coronavirus cases in Victoria. There are 20 new reported cases today, taking the total of confirmed cases in Victoria to 1,884. 7 are linked to known outbreaks. 1 has been detected in hotel quarantine, 9 through routine testing, and 3 other cases are under investigation. Sadly, a man in his 80s has died overnight of infection, which brings the total number of deaths in Victoria to 20. There are 3 staff members who've tested positive at Hampstead Dental Clinic in Maidstone. All staff members of the clinic have been classified as close contacts and will be tested, but there are no patients who've been identified as close contacts. There are now 241 cases that have been identified that indicate community transmission. That's an increase of 8 since yesterday. That number has been around 10 every day. But a decrease of 8 is somewhat encouraging. It certainly means that we're not getting an increase or an exponential increase in community transmission cases day by day. But there are 141 active cases in Victoria, over 1,000 close contacts. Some additional information on hotel quarantine. We've got 30 current cases in hotel quarantine. And a total of 196 cases who've gone through hotel quarantine and tested positive since the program commenced. In terms of outbreaks, there are 3 new cases linked to the Keilor Downs family. All 3 are existing close contacts of known cases. That brings to 15 the total number in that outbreak. The 3 in Hampstead Dental, as I've mentioned. There's an additional household contact of an H&M Northland staff member, which brings that outbreak total to 5. And there's another close contact, a social contact of a St Monica's College Epping case, which brings that number to 2. Villa Bambini Early Learning Centre in Essendon, I think, was updated yesterday. It's closed today after a child tested positive. And contact tracing and cleaning are underway while that's closed. As you know, we've noted the increased activity in certain suburbs, local government areas around Melbourne. There's been a real surge on testing. That's put a lot of pressure on the testing sites, but since the weekend we have worked with planning to get as many new testing sites up in those areas as possible. That includes from today the showgrounds, which will be open from 1 p.m. today for the Keilor Downs Secondary College students and families. And from tomorrow, that site will be open to the general community. Footscray Bunnings also has a pop-up drive-through testing clinic, and there's a newly established pop-up site at Craigieburn Centre that will be open 7 days a week. We know that the demand on testing has increased significantly. Victoria really does have the highest testing capacity in Australia at the moment, but human behaviour is a strange thing. The message hasn't changed. We've always said get tested with mild symptoms, but obviously there's a lot of concern around the increase in cases in recent days, and there's been a huge increase in demand on testing. There have been queues for those testing sites. Chadstone, for example, has needed to divert traffic and really not have people flow through that testing site until the police can manage the traffic appropriately. So we do apologise, and we ask for people to be patient. People should go to their GPs in the first instance to see if they can get testing there. That's obviously going to be much more straightforward for them if they've got a booking, but also to look around the website and see what alternative testing sites they might be able to go to where the pressures on numbers aren't quite so great. Happy to take questions.
Are there enough testing kits available to deal with this increased load?
Yeah, there are. We could test over 20,000 people per day. That really, relates to record numbers in Victoria. So the testing capacity is there, but the demand has spiked incredibly, not unsurprisingly. But I guess, we need to be mindful of that ongoing demand. We want to be able to meet it. We are encouraging everyone with mild symptoms or significant symptoms to come in for testing at any of those sites.
So Keilor Downs Secondary College people are being asked asked to get tested even if they don't have symptoms? Is that right?
No, it's for those with symptoms, no matter how mild, to come to the showgrounds from 1 p.m. today for testing purposes.
Why have you singled out that particular school?
Well, it has had a number of students related to the Keilor Downs family outbreak, and so, you know, as a matter of trying to find any students who might have picked up illness from community transmission identified, or their family members, we are encouraging them. Keilor Downs is clearly a hotspot in Melbourne at the moment.
Is there any record yet of any transmission between students?
Not clearly. We know that there are some settings where there's been more than one student identified. Whether that's multiple cases linked to community transmission or transmission between students is yet to be determined, but we're looking into it.
Do you have to clarify which family clusters have been related to hotel quarantine security items?
So the Hallam family cluster has been related to the quarantine hotel.
So not the Keilor Downs?
No.
And that is a worker at hotel quarantine brought the virus into the family, or was it the other way around?
No, it's suspected that a staff member, or rather a contractor at the Stanford Plaza, has brought it to their family.
And about the testing, what's happening there? There's stories this morning that they were looking at asking hotel or returning travellers to go with the state, then it was decided to keep them in Victoria. Can you run us through what conversations have been there?
I'm not involved in those conversations, and really it's a federal decision around how chartered flights are distributed across the country. Obviously Melbourne's taken a lot of flights. We've had over 3,000 continuously in quarantine because of chartered flights coming into Melbourne, but actually the majority of flights coming into Melbourne are commercial flights that are picking up in recent weeks. So the majority of our hotel quarantine cases actually come from commercial flights, but decisions around how you distribute the chartered flights that the federal government does have more control over is for the feds to talk through with states and territories.
Well, what would your advice be? Would you prefer them to be shared more evenly, or do you think we already have things in place so we might as well keep them?
Look, I don't know the distribution of spare capacity. There are plenty of pressures in New South Wales and Victoria at the moment in terms of numbers. We're taking the lion's share between us. But I'm not sure of the spread of capacity and cases across the country. But I think that's something that's talked through a national coordination mechanism on a weekly basis.
Just back to testing, in particular Chadstone, again, there were signs up there by 9 a.m. that testing had been suspended already. If we can do 20,000 tests a day, what's going on?
Well, you know, those 20,000 tests are about the laboratory capacity to process them on a daily basis. All the materials, all the reagents, all the test kits are available up to those numbers. But the focus on where people go for testing has obviously gone to some really focused areas for convenience. All I'm saying is you need to shop around for your testing. Because there will be some sites that are under significant pressure because of that convenience, but there'll be some other sites and GP practices and other pop-up and roving clinics that people need to look out for so that they are not spilling out onto the road that requires the traffic management that has affected Chadstone today.
So is it just because of traffic that Chadstone has closed for the moment, and will it reopen later today when police are there?
Yeah, my understanding is it's a traffic issue. As soon as police can manage that traffic flow, they'll be available for testing again.
How long is it going to be before people can get results?
Well, results have been turned around in a couple of days. I think even now still, you know, with the thousands of tests done over the last couple of days, some of those results might take longer. But again, the message hasn't changed for anyone. It's just unfortunate that people are only really prompted to testing by an increase in cases. We want people to test all of the time, not just when there's some anxiety about, you know, where case numbers are going. We have an opportunity to control numbers across Metro Melbourne if everyone, all of the time, considers that if they're symptomatic, they isolate at home, they don't see others, they present for testing, they get a negative result and they can go about their normal life, or they get confirmed as a case and we can follow up and control transmission.
Brett, how many cases are linked to hotels in terms of staff, close contacts of staff, and community transmission as a result of that? And that's both for today and over the last 10 days.
Oh, I think it's over 30. I think it might be 33 or more, but the exact numbers as of today, I'm not sure.
Is there in terms of the mingling, I think it was described last week as at the hotels, Was that between security guards and guests, or was that between security guards and other security guards? Or
Yeah.
maybe were the guards getting too friendly?
Well, there was some concern about the distancing between those contracted security guard staff. I think, it's always a risk when people are more than less than 1.5 metres distance apart. There are a number of staff, some of those spaces where they gathered meant that they were too close together, so that's been observed. Obviously, it's been reinforced that distancing needs to be maintained at all times for everyone.
So have staff been warned for being too friendly with guests or too close to guests?
Oh, they know the protocols in regards to how to manage accompanying guests for fresh air. So the same messages in terms of the distance that they need to keep and the hygiene procedures that they all need to go through routinely.
Have there been any instances of security guards breaching those guidelines with guests in terms of the distance between them?
Not that I'm aware of, but clearly there's been transmission to those contracted staff, and so whether that's been from a surface or whether it's been from a guest to a contracted staff member through respiratory droplets, it'll be impossible to find out, but we're reviewing all of those processes, as I've said before, to make sure that those staff aren't put at risk unnecessarily.
Nothing has come up in any of the contact tracing interviews that would suggest anything inappropriate?
Not that I'm aware of, no.
Do you think the ADF needs reporting to help out at hotel quarantine like in New South Wales?
No, I don't think so. I think, we've gone through a thorough review process, and there's been additional health service support to infection prevention and control, and with a review of all processes and everything that might have occurred in the past, I think we need to see that it's under control. If there are further things that we need to review, further actions that we need to take, we'll do so. But there is no constraint on personal protective equipment supply, and obviously those contracted services have an obligation for their staff members, an OC health and safety obligation to make sure that they're putting in all of the procedures to keep them safe.
Is that been an issue because I know that some have suggested that they can't get easy access to PPE?
Well, it shouldn't be an issue. The PPE is entirely covered by the department in terms of its cost, and the supply is not an issue at all. So if there have been concerns about PPE, it's not because of supply constraints or because there are cost issues.
How many cases altogether now are linked to Keilor Downs Secondary College?
I think it's secondary college.
Yeah.
Not in front of me, I'm afraid, but I can update you later. Yeah, it's a gentleman in his 80s. Very, very sad occurrence that someone's died, but the family have requested that no further information is given. I'd like to respect that. It does point to the fact that when we get additional cases, there will be a risk of people dying. There'll be a risk of further cases being hospitalised and going to intensive care. That's why we need to get on top of numbers in general.
What concerns you about the new RAF number reaching 2.5? What's that mean?
I mean, the reproduction number, or the effective reproduction number, the REF, is something we want to keep below 1. When it's below 1 case on average transmits to fewer than 1 case, and numbers continue to drop over time, and we could get to 0. When it's at 2, it means that the active cases that we have are doubling with each generation. We have seen the community transmission numbers go from single figures to above 10, so it's no surprise that the REF is at 2 or above. But with the stabilisation in numbers in the last few days, I expect that will go back down, and I absolutely hope that we can get it below 1 and drive those numbers back down to 0.
What was our rate when cases were increasing a lot back in the peak or in March, right?
Yeah, it would have been close to 2.5 or 3 back then. Clearly, we had an exponential increase until mandatory hotel quarantine came in and the mass gatherings were put on hold. That really turned the effective reproduction number around very quickly, but it was certainly above 2 at that point in time, and rapidly went below 1, had been below 1 until a week, 2 weeks ago. So, we had an opportunity to drive numbers down. We still have that opportunity if people can isolate, test and have contact tracing take place.
At that point, when that was a lever you had available to you to pull the hotel quarantine.
Yes.
Now that ref is kicking up again, is there any equivalent lever? Is there an obvious next step?
Well, that's the point I've made in recent days, that the primary lever that we have now is a test and trace mechanism. And so really broadening the testing availability and the messaging and reach everyone about the need to test if they're symptomatic is our key driver to get numbers down. Obviously, all of the messages about keeping your distance, about hand hygiene, about cough etiquette, about not visiting others when you're unwell, they're all things that make a huge difference. People may not understand how much of a difference it makes, but I think the significant uptick in the last couple of weeks is because those very things haven't been followed. Those are the things that will maintain low transmission in Victoria.
We're seeing Premier Ford with an army of people going door knocking from today. Do you think in retrospect more could have been done to message communities where English is a second language?
I mean, we were down to 1, 2, sometimes 0 cases of community transmission. When we've seen who's been identified as cases in recent days and where those chains of transmission have occurred, we've clearly reached into those communities. It's a complex process. We've always had information in multiple languages. I've been very actively engaged in multicultural engagement, obviously with the Chinese community way back in February, March, but ongoing. I've met with the Islamic Council of Victoria recently. We're meeting with a whole number of ethnic community representatives, and I have always advocated to our comms team to engage with our intelligence team around where are our cases, what communities do they represent, and to use all mechanisms to reach into them. It is not a simple case of pamphlets and campaign materials and banners to reach into communities. You do need that community leadership, community champions, and all of the modes and methods available to you to try and get messages out. It's not an easy task. There are people who use social media from their country of origin or amongst their network of friends as their primary source of information. A lot of that is false information. A lot of it tells them that it's all rubbish, the messaging from government. So we have to meet people where they are, and we have to get those messages penetrated as much as possible.
Is there any additional advice to businesses, cafes, restaurants, etc. in the hotspot areas above what there is for the rest of the community? Should they be limiting more so than others?
No, I don't think so. I think we're not seeing transmission in those areas, and I think that's a really good sign. Despite the community transmission, it does mean that if you can have the density quotient in place, if you can have the physical distancing in place and the hygiene and cleaning measures, then you don't get transmission in those settings. So they should feel confident that they can continue as is, and people should feel confident that they can go to those settings again if they're well and if they're not meant to be isolated or in quarantine.
Is it correct that some of the communication to people who had tested positive until recently has only been happening in English? There was only a capacity to do that in English? I'm not sure. I can get back to you on that, but our website, which people are directed to, has information in multiple languages. So there is, there are over 55 languages that have been translated for our key messages. Is there also a difficulty, I hope I'm not dealing in stereotypes here, but with some ethnic groups who may perhaps be inclined to be more suspicious of messages coming from government and authorities? Look, I think it's an issue in pockets of communities everywhere. This is not an easy behavioural task to go through, and when the levers of government to really change every aspect of your life are in place, people go to other sources of information that question it. So we have to work with every single community member, and I think there are pockets and individuals and networks within every single community where there are suspicions about the key messages and where there is misinformation that's circulating quite freely. So we need to compete in that space and make sure that the evidence-based messages, the things that we know have worked and would continue to work, are out there in full.
With community transmission picking up, how useful has the COVID Safe app
Look, as I said previously, it's an important thing for people to download. It will help us in those circumstances where someone has been a close contact, but they don't know who they've been next to for 15 minutes or more, or in a room for 2 hours. We haven't had cases that have already been identified through our routine picking up the phone contact tracing. But as we go to more movement of people and an opening up and a lessening of restrictions, the app will be more and more important as time goes by, because there'll be. There haven't been new contacts identified through the use of the COVID app, but there have been over 30 cases where the app's been downloaded. But our contact tracers go through a really thorough process on the phone, and in a sense it's encouraging that people who are identifying their contacts can remember everyone that they've been in contact with for 15 minutes or more. I think it's also a sign that almost all of the close contacts, if not all of the close contacts, are those people who are known in the network of cases, people who are the household contacts, the extended family contacts, the close friends, and so they know their contact details, they know their names. It's not about walking past someone or standing in line with someone who you haven't had an existing relationship with.
Just comment to made before about the numbers. You use the word stabilisation. I think most of us are concerned we've had 8 days in a row of double-digit figures.
Yeah.
But you actually glad that it's not rising further.
Correct. I was very concerned a week ago that those numbers of 10 community cases would be 20 by now. I think it's a testament to our contact tracing efforts and the 24/7 work that's going on that we've managed to keep that number stable. The risk is absolutely that it could double every week, and that's why we have to really go out in force with testing and all of the contact tracing and all of the engagement.
Is it even more pleasing that those numbers are relatively stable when the level of testing has risen so dramatically the past few days?
Yeah, I think so. Look, we might get some additional cases identified through the ramp up in testing, which might increase some of those cases. But every case identified is an opportunity to stop transmission in that household amongst that cases network.
For people that are living in hotspot areas, could you give them some clarity and advice in terms of going away? The federal government seems to be saying if you're in those spots, don't go on holiday. Daniel Andrews seems to be saying if you're not unwell, you can go away. Can you just give them some absolute clarity on what the advice is?
Yeah, sure. Look, from my perspective, there was a message from HPPC that was focused on interstate travel. When there are jurisdictions around Australia with no community transmission, they've got a very low threshold for a warning to come to those jurisdictions, especially where borders are open. In Victoria, we've got transmission across Metro Melbourne. So for all of those areas, it's not about saying you can't leave there. For all of Metro Melbourne, it's not about saying you can't visit these local government areas or you can't visit these suburbs. It is a message for those areas. You have to be particularly aware of people with symptoms. You have to be particularly aware that if you or your kids or other family members develop symptoms, that you go for testing, because the transmission is higher in those areas. So it's really a message about having an awareness of testing and the need to get tested and isolate until you get that result. That will turn it around in those areas. It's not about shutting down. There is no government directive to stop people from leaving their home or from doing normal things. We have said all along, just because you can do it doesn't mean you should do it. So don't have a different gathering of 10 people outside or 10 people in a social setting if you don't have to. Don't do that every day.
Sorry, what about going out of town?
Going out of town is okay. Again, I would emphasise, if you're unwell, you shouldn't be. You shouldn't be going anywhere. You should be at home, getting your test, getting a result. But especially for families who want to leave Melbourne, that's okay. It is less of a risk if they're going from a residential setting in Melbourne to a holiday home as a family. But if you're mixing with people you don't normally see, multiple families, multiple groups of friends, that's something I think people need to reconsider, because you can have very mild symptoms. You can have kids who are asymptomatic, or others who are asymptomatic or not yet symptomatic who can still transmit.
So if you don't have your own holiday house, you should think again about going out of town for school holidays?
Look, I think it's important that everyone who hasn't yet made plans or who hasn't yet made a financial commitment thinks about what their holiday plans are. If they're meeting with multiple new friends, new acquaintances, then they should reflect on that and they should think about alternative plans. And it might be just going away as a family. It might be just meeting a couple of friends who they would see on a weekly basis, for example.
We've heard a couple of stories this morning of accommodation providers out of town knocking back bookings on the basis of Melbourne postcode coming from those particular LGAs. Is that wise or over the top?
Look, I guess it's their prerogative. They should feel free to do as they wish as businesses. But the case numbers are still 10 out of millions in Metro Melbourne. So it's a very, very, very low risk for any one individual. But each business will have its own risk tolerance point, and they can make a decision as they see fit.
It's a bit hard. Some of these local government areas are quite large, and there are some suburbs that are completely unaffected, and yet the whole area has been, if you like, tainted by financial suburbs.
Yeah, look, none of it's intended to taint local government areas or indeed suburbs, but the awareness about testing needs to be focused in those areas. And just because we know of cases in particular suburbs doesn't mean that's the only place where cases will be. There will be other chains of transmission, other not yet diagnosed individuals more broadly across those suburbs and within those local government areas. People move about within those local government areas. But no, it's not to taint them and say that there's no possibility of cases anywhere else in Melbourne. We know that there are small numbers across multiple suburbs and local government areas in Melbourne. The message is there for everyone.
Can you give us an update on the advice regarding face masks? The Victorians about to be told that they should be wearing masks around?
The national advice on face masks has been that there's no reason for well people across the community to be wearing masks. The global advice from WHO is that masks have a place, and in fact they've recommended it where there is significant community transmission and people cannot physically distance. So I want to work up some advice that's in line with that. The other jurisdictions in Australia are not at a point where they need to provide advice because community transmission levels are at zero or very close to. But for Victoria, I want to consider all of the interventions that might help turn these numbers around. And so if some of that advice is around wearing masks where you can't physically distance, if you're going into a marketplace, if you're going into a busy shopping centre and you haven't got an alternative time that you can go, if you know that people are coming within 1.5 metres, then a mask might be appropriate, but that's being worked up.
Can I just ask you about reports that people are starting to panic buy again? You talked about odd human behaviour before.
Yeah, look, there's no accounting for panic buying. There's no need for it. There is absolutely no need for it. Of course, people are not going to run out of stock. There are not going to be hundreds of people in isolation because we've got hundreds of cases. We've got a small and steady but very concerning number of cases over the last week. So people can go about their shopping as per normal.
Just on that rate of spread being 2.5 again, what's the biggest contributor to it? Is it that people are mixing in bigger groups? Is it that they're not respecting social distancing? Is it community transition? And on that, you said previously that the number of close contacts is about 1,000 that are in isolation. Is it still around that? Where are we up in that number?
Yeah, I haven't got an update on the numbers in quarantine as close contacts, but it's usually about 10 times the number of cases that we've got active. So it'll be around 1,300 at the moment. One single case usually has, on average, about 10 close contacts who need to be in quarantine. I think the transmission that's occurring is because people are seeing others, friends, acquaintances, family members, sometimes because they're in big families, sometimes because their extended families are very large and are transmitting unwittingly to those family members or friends. We all do it. We've all seen friends, we've all seen family members, but we are not doing as well as we did a month ago in terms of making sure that we keep our distance, not hugging, kissing, shaking hands. We need to keep those habits in play for some time yet.
Just on the AFL, Conor McKenna's positive test, then he had a negative test and there's some confusion over it. If he has 2 negative tests, does his close contact still have to isolate? It's hard, isn't it? Because their whole competition's been affected, but there's some confusion over whether or not he actually has it.
Well, it's a positive test. It's being treated as a confirmed positive. There are lots of people who test positive one day, they're at the very tail end of their infection, they test negative the following day. If you get 2 negative tests 24 hours apart, you as a case are clear. But your close contacts are the contacts of you when you're potentially infectious. They have to go through their 14-day quarantine period, and that'll apply to Conor McKenna's contact as for anyone else.
I think some people got confused by the fact that that negative test yesterday. So does that simply mean, yes, he did have it, but that negative test indicates he's probably recovered and got those antibodies now?
Yeah, look, for anyone who maybe has a positive, negative testing sequence, their virus is at low levels now, they are recovering, and 2 negative tests give us the confidence that someone isn't infectious. So I think that's the case here in all likelihood.
Just one more question on the hotels. Were you consulted on the initial decision to use private security contractors rather than the ADF?
No, not me personally, no. My role is to provide advice on public health, and obviously I supported the National Cabinet decision for mandatory hotel quarantine as a means of controlling numbers in Victoria and across Australia.
But the logistics is Department of Jobs, right?
Emergency management within DHHS, Department of Jobs has been involved with emergency management, Victoria oversight as well.